Hi, I'm Dr. Craig Smith, one of the GPs at Avondale Medical Practice at Strathaven Health Centre. We thought this would be a good time to update you as to what has been happening over the course of the past 5 months since lockdown due to the COVID-19 pandemic. First of all, I'd like to thank you for your patience and understanding as we've had to change how we conduct general practice over the course of these months, and to thank you generally for the support that you've given to the practice and to the NHS in general over the course of these months, which have been quite difficult. As you will be aware, we've had to change the way that we see patients, and the main thing is that we've had to move on to remote consultations, whether by phone or by video consultations. This is something which the Health Board and the Scottish Government are keen that we continue to do, and we will be doing this for the foreseeable future. The main thing to let you know about is that we continue with telephone triage, and I thought it would be a good idea just to go over how this is happening in the practice. If you want to speak to a doctor, the telephone lines open at 8:30 weekdays, as they always have done, and we would ask that you would try and get your appointment in before 11 o'clock. The reception staff will take your name and a contact telephone number, and will ask a brief outline of what the call is about. This is so that the doctors can prioritise the calls. The doctors will then phone you back throughout the course of the morning, although occasionally due to the workload this may run into the early afternoon as well. Once we have spoken to you, there may be a number of outcomes from the consultation. If we can deal with your problem on the phone, we will try and do that, and if you need a prescription, we will organise this to go to one of the chemists, and you can pick this up later on in the day. There may be other occasions where perhaps you have a rash or a mole or something on your skin which you're worried about, and we may ask you to email us a photograph of this. If that's the case, the doctor will look at that later on in the morning and then get back to you and decide what we need to do with that. We will never ask you to send a picture of an intimate area, and all pictures are only looked at by the clinicians, and we would treat these pictures in confidence as we would do with a normal consultation. There may also be times where a video consultation might be appropriate, and Dr. Turner in the practice has done a number of these, although it's not something we've done a lot of, but it's something which we hope to do more of in the future. If, however, we feel that seeing you face to face is the most appropriate course of action, then we will arrange an appointment with you. What is tending to happen at the present moment is that we do all our telephone calls in the morning, and then if we need to see people, we'll see them in the afternoon. There may be some times where a morning appointment is more appropriate, and that will be organised with you and the doctor in question. As before, we would encourage you not to come to the health centre unless you have an appointment. However, if you do have an appointment, come into the building, tell the reception staff that you are here, and then take a seat in the waiting area, and the doctor will come out and get you. We would ask that you come in time and not come early. That is just to limit the amount of time that you're in the building. And as before, please use the hand sanitizer when entering and leaving the building. And we would also ask that you would have a face mask on, and the doctor or nurse who sees you will also have appropriate PPE on as well. If at the end of the consultation with the doctor a prescription is appropriate, that again will be sent to the chemist of your choice. The pharmacists have asked us to do it this way. This is to prevent people queuing in the shop waiting to get their prescriptions dispensed. Other services are starting back up within the health centre. The treatment room and the phlebotomists have been working now for about the past 4 weeks, and this at the present time is still limited, but they are doing urgent bloods and appropriate injections and dressings at this time. The district nurses continue with the work in the community as they have done over the course of the past 5 months, and the health visitors as well have been looking after the children and the mums, and in conjunction with ourselves we have continued to do the 6-week baby checks. And our own practice nurses have seen patients or telephone patients over the course of these months, and the chronic disease management programme is starting once more, although this again is slightly limited, although you may have had some contact with the practice nurses about this. Cervical screening it has been re-established, although there will be a backlog for this, and breast screening as well has also recommenced, although the breast screening unit is not due in Straven this year. As a practice, we have been busy, perhaps not as you might expect, but over the course of these 5 months as a practice we have dealt with 4,500 telephone consultations, we've done about 220 house calls, the practice nurses between them have either seen or telephoned about 1,000 patients, and as clinicians we have seen about 1,500 patients actually in the building ourselves. It has been difficult, but this is the way that we need to move forward with this, and I would remind you that if you do feel unwell or have any medical concerns or worries, please contact us and we will deal with this in the most appropriate way. Thank you again for all your cooperation in this difficult time, but also remember the coronavirus hasn't gone away, and if you do have a cough or a temperature and there is concern that it is coronavirus, please contact NHS Inform for your COVID test and appropriately self-isolate until you get the results of that test. Thank you once again.